Hello, this is Dr. Ravi, and it's day one of lockdown here in Kuala Lumpur, Malaysia. And I wanted to just produce a short informational video for those of you who are now adapting to COVID-19 and the pandemic. We're doing a lot of work at the moment around pandemic management and working with health services on how to manage the situation, and particularly using a maturity model to actually work out what services and resources are required at this time. One of the things that many organizations are currently adapting to is working from home or working virtually or remotely. Now, my organization has been doing this for several years now, so I'd say we're pretty good at it, culturally, systematically, and from a process perspective. We've got a lot of these things down pat, so there's no real change for us, but we're seeing massive changes across many organizations who are now adapting and having a lot of their workforce work from home. Now, with health services, a lot of care needs to be given on site, obviously still, with hospitals and so on, particularly because you have a lot of equipment that you're dependent on and infrastructure needs. However, for those of you working from home, and for those of you CEOs, executives and managers that are now shifting your workforce to work from home, here are about 5 things that you need to be thinking about. I apologize for my puffing. I am doing my evening walks after a long period of isolation, where most of us here have been advised to be isolated. So this is my short time to get some exercise. But in terms of working from home, things you need to be thinking about or working on that they don't always tell you in the textbooks. When it comes to working from home. One, maintain your culture and maintain your team interaction, and particularly around social bonding. So what I mean by that is typically once you start to go online, you don't have the water cooler conversations anymore. You don't have the bumping in the corridor conversations anymore. So you actually have to increase these interactions intentionally. You actually have to set up social time. So for us, we actually have deliberate hours blocked out in the calendar for us to just have a social conversation. No work conversation. It's deliberately blocked out. This is typically Friday afternoons for us. We've blocked out about 75 minutes just for that, simply because you do not tend to social bond more once you're working from a virtual environment. So this is really important. The other thing to do is to have more regular huddles. So what I mean by that is we now having COVID-19 prioritization huddles every morning. Many organizations are used to having these huddles. These are just 15 to 20 minute meetings on what's going on, what's urgent, what are the activities that you're working on today, reprioritizing them based on the needs of today, particularly as information and new information is coming in every single day. Some of it is different, significantly different to the day before, particularly around lockdowns, travel bans, events being cancelled, and so on. So I strongly recommend you have a huddle in the morning, or particularly in the afternoons or evenings. Some of you may be working quite intensely at the moment, particularly around developing products or repurposing your products or services. So you might even do huddles twice a day in order to reprioritize the work that you're doing. But also it helps you to have a conversation about the well-being of your team. And the third thing, aside of the social bonding, is deliberately ask about the well-being of your teams. What I mean by that is in our conversations, I specifically ask my team how they're going, how do they feel, particularly ask about their feelings. I know this is uncomfortable for many people, but this is the essence of culture. This is the essence of human interaction and team interaction. Asking about what they're worried about, what their fears are. You don't have to solve all the fears. You just have to understand and empathize with what they are. So some examples are, some people may be staying alone. Some people are worried about their mums or their dads. I have one staff member who is in a different country, in Philippines at the moment, went on holiday on an island and now can't get back to Manila, and therefore is distanced from her family. She's stuck on this island. Fortunately, she's got a laptop. She's able to work, which is keeping her occupied and engaged. But obviously now expenses are drawing up and we're providing some financial support. So that's the fourth thing, which is think about what other additional support you can provide to your staff at this time. Now, it could be just emotional support, but in some cases that support may even be financial, and it may not be much, but it could be required. So we've actually just created an emergency support budget that we've locked in, and some of that's already being allocated to this particular staff member, but also to prepare for any other sort of key emergencies. Now's the time to show that we care for our teams and our staff and look after them, because many of the people, particularly in the health services, are right now at risk of fatigue or burnout, and if not now, then fairly soon. So we've just got to make sure that the emotional support is there, and that we're not panicking, but we are re-strategizing and working very hard to change our strategies and look at how we can serve better at this time. So the other thing around working from home that I wanted to talk about, which is the fifth thing, which is around file management. So many organizations, ourselves, we're basically 100% in the cloud, or most of our files, 90-95% are in the cloud, so fully accessible. However, many corporations still have on-prem databases where you can only access these files from the site. Now, fortunately, some of these large organizations that we've worked with have got backups from a site number 2 or an alternative site already locked down in their business continuity plans. So for those of you who are unable to access your files before you do go home and start working virtually, just make sure that these files are either in the cloud or you've got a VPN, which is a virtual private network that your organization has, in order to access these files whilst you're working remotely. It's better to do that now and have those conversations earlier than before you end up at home and not being able to work because you can't access key files that you need as well. So those are 5 tips around working from home. If you found them useful, please comment at the bottom of this video. Let me know if they are useful, what else you'd like to know. We're working on the situation every day with different organizations, health services, talking to ministries of health and so on around this as well. So I'm happy to share information as we go around, just to manage your life, your work, your business, and your healthcare organization during these tricky times with COVID-19. Stay positive. I'm Dr. Avi. Bye for now. Lots of love.